The Ghana Association of Medical Laboratory Scientists recently marked the International Federation of Biomedical Laboratory Science Day with a public lecture themed Biomedical Laboratory Scientists Promoting Sustainability in Clinical Diagnostics. The event underscored the pivotal role of laboratory professionals in enhancing Ghana's healthcare system. Granting an interview with the media during the event, President of the Ghana Association of Medical Laboratory Scientists, Dr. Aidoo, voiced deep concerns over the government's neglect of medical laboratory scientists. He highlighted that for the past 4 to 5 years, newly trained laboratory professionals have not received postings, leading to a significant brain drain as many seek better opportunities abroad. Dr. Aidoo emphasized that inadequate remuneration and poor working conditions are driving these professionals away, a development which could compromise the quality of diagnostic services in the country.
So from 2020, the government has really not employed any medical lab scientists. And so if I talk about we being neglected, we saw nurses, about 15,000 being employed without even one of medical lab scientists employed. In that sense, because we work in the same health working space, we will feel neglected. Most of our people are leaving to go and see greener pastures because we sit in the labs which are not well resourced. The working environment that we sit in, are not the best that we are supposed to be. And then more also, the person is poorly remunerated. So if the person is not being taken care of well, as far as allowances are concerned, and then he also sits in an environment which is not ideal for him to work, the person will feel frustrated and leave the country to where he can. Yes. So we have our members now. If I'm not mistaken, we have nearly like 1,000 people leaving the shores of Ghana to go and seek greener pastures. And this is alarming because it is affecting the medical lab services in Ghana.
The Director of Allied Health Professionals at the Ministry of Health in Accra, Dr. Ignatius Neko Awinibonu, who represented the minister at the event, acknowledged the challenges faced by medical laboratory scientists and reaffirmed the ministry's commitment to addressing them. He, however, urged the laboratory scientists to inculcate modern technology in their work.
Because we are in a resource-limited environment. We don't have all the money, the resources. So the little that government gives them, or the facilities given, they must maximize it so that they can be able to get to a lot of patients. So, for instance, you should not allow things to expire. All right? That's a wasteful attitude. You should see how you can maximize a lot from the little. And effective simply means that when you provide your diagnosis, it should be so up to the point that once it is dependent on for care, the patient receives healing and is restored. And I also told them the need for us to inculcate technology, digitalization, artificial intelligence in the laboratory practice to make the service more sustainable, easier and cheaper to manage than we currently are. All these are tools that we must reflect on and try to make clinical diagnosis more sustainable on this very special day.